Okay, everybody, are we ready to get started on our next session? So our next session is the Public Health and Public Safety Partnership Panel, and we have Crystal Pulaski, the Program Coordinator for McCracken County Drug Court. I stumbled over that, and I should have done a better job since she's the only other ski I have met in the area. So my apologies. We have Stephanie Rio. Okay, that's what I was going to say, but then I got self-conscious about Crystal's name. Operations Supervisor for the Department of Pretrial Services, Ryan Wilcutt, the Chief Deputy for the McCracken County Sheriff's Office, Blake Quinn, Community Engagement Officer from the Paducah Police Department, and their bios and some interesting information is in here with the speakers. So we're just going to go ahead and get started, and we're going to start with Stephanie, and we'll work our way down, and they're going to tell you a little bit about the different things that they're doing and cover some of the bullet points that you see there, but we will let Stephanie go with Senate Bill 90.
Okay. Hello. Just a brief introduction. So I'm Stephanie Rio with Pretrial Services. I've been with them for about 11 years, and we're housed under the Administrative Office of the Courts. In 2022, the legislative group, as a big bipartisan effort, came together and kind of made SB 90. It was an effort that came from a Pew survey to help eliminate barriers and expand treatment across Kentucky. Their recommendations included creating a robust statewide diversion program that links patients with quality treatment, eliminating barriers to medications for opioid use disorders in community-based treatment, expanding access to treatment for pregnant and parenting people and individuals in rural areas, and expanding access to wraparound services / recovery support. So from SB 90, they created a pilot program, which is called the Behavioral Health Conditional Dismissal Program, which began on January 1st, 2023, to divert defendants charged with certain nonviolent, non-sexual misdemeanors and Class D felonies away from jail and into treatment for substance use disorders or mental health issues. Part of the pilot program part of the bill is that they had to have 10 counties that were interested in joining the pilot. They got 11, and McCracken County was one of those chosen, so that's why I'm here today. The pilot program itself will last for about 4 years, so we're about 5 months in. But what SB 90, or the Behavioral Health Conditional Dismissal Program, or BHCDP, I have to be careful with my acronyms because not everybody knows what I'm talking about. But what it does is it targets low-level offenders to get them their cases dismissed, discharged, if they have a mental health or substance use disorder. So what happens is when someone is arrested, they get screened through a pretrial. They have a risk assessment done. It's called the PSA court, and that determines their risk level, which is low, moderate, or high. So we're looking at these low folks. And once that is established, what will occur is it has to occur within 72 hours. They have to have a clinical assessment done by a qualified mental health professional. Once that assessment is done, it comes back to pretrial, and we will, if there is some sort of indication of mental health or substance use disorder, it will trigger a series of offense, which will involve the courts and the prosecutor, defense counsel, and the defendant, where they will come to an agreement, and for that agreement, the agreement can't last longer than the highest level charge they have. So we're looking at Class D felonies or below. So the program shouldn't last more than a year. And within that, they are going to be recommended some sort of treatment from the clinical assessment. They get to choose their provider that has been pre-approved by behavioral health. That's kind of like the nitty gritty part of SB 90. And since we only have 10 minutes, I won't get too far into that. But behavioral health does approve who is an eligible provider, and as long as the person or participant follows their agreement, and it can include restitution and a few other things, but really the main focus is their treatment. And they can get an assessment done by Kentucky Adult Education for those wraparound services that were originally I mentioned. That's the big part of it, is they'll get an assessment through them, and if they follow all their conditions at the end of, let's say, a year, they come back to the court and their case is dismissed, averted. Which, if anyone knows anything about felonies or criminal cases, dismissed, averted is a huge deal. And since it's dismissed with prejudice, the charge is actually expunged, so automatically. Which, once again, is a very big deal. And this is at no cost to defendants. We were given, as part of the funding, $10.5 million that is distributed by the Department of Behavioral Health, and it's through the opioid abatement funds. So they control this $10.5 million, and that is for all 11 pilot counties. And it's 10.5 each year. So it's a lot of money coming through. They really want to see people succeed with their treatment. And that's a part of, if someone's not covered by Medicaid, they will, if they don't have their own insurance, like if they're underinsured, they'll pay for that part of it. They're working on like housing, and transportation is a big issue everywhere. So that's another big area they're seeing on how they can support participants in their path to recovery. Another big part of this was just data collection. They want to see what's going on. So if people start, demographics, where do they end? Also, are they picking up new charges? So on and so forth. The new charges is is a big part of it. Right now, we are currently, as of January 1st, we did do a soft rollout in Letcher County, one of the other pilots. And it was a great place to start because we've kind of worked out the kinks on processes, because there is a heavy emphasis within the bill to have local procedures there. So we've kind of worked out some of those kinks, and we're just about ready to get started to our next phase. There is an implementation council. We're meeting on the 24th of this month, and we will be discussing the next location that will begin with implementation. We're hopeful that we'll, hit some high points and get it to McCracken itself, although right now can't say for sure when that will be. But we do know for providers, and I think I actually recognize some folks here from our stakeholder meetings back in December. Behavioral health, the application is open to all providers now, and starting July 1st, they actually expanded the criteria. Before it was super duper limited. Now they've included a federal accreditation that would be equal to Kentucky State accreditation. And so that will probably determine a lot of where we go next, just to see where the providers are. The pilot sites were chosen based off of a variety of factors, like the operation of a local jail, and then even just the availability of community and mental health interest programs. So that's why some rural locations like Letcher and Greenup were chosen, just to see what we could do there with limited resources. And then, of course, in McCracken and Kenton County, what we could do with where there's more resources available. So we're excited to get started with that next phase of it.
So we're going to let everyone go and then have questions at the end. Okay, Crystal?
Good afternoon. I'm Crystal Pulaski with McCracken County Drug Court. I am the program coordinator. McCracken County Drug Court was implemented here in McCracken County in 2005, and today we are targeting high-risk, high-needs individuals. We have a whole enhanced services. We work closely with our community agencies, including our law enforcement, probation, parole, our circuit court judges, Commonwealth's Attorney Office, and the DPA. So once someone comes in contact and is justice involved through a felony offense, at that time either their attorney can request for them to be screened to see if they're eligible for a drug court program, or the individual themselves can ask to be assessed. The judge signs that order. We do a screening on that individual. It usually takes about 30 minutes. I then take it back in front of my team to discuss if this person is eligible. Are we going to accept this individual in the program? At sentencing, the judge will make that decision whether to probate that participant into our program or sentence them to do time. There's two tracks that we do in the drug court program, the first one being probation track. Generally, if someone pleads guilty, they're found guilty at sentencing, they receive 4 to 5 years probation, if that's the track the judge chooses. They come into our program, they complete the program. Our program's based on 2 years, give or take a little bit. Once they complete that program, generally their probation is done at that period as well. The diversion track is like she mentioned earlier. If they are on diversion track, once they complete our program, that charge is automatically dismissed from their file. Like that, it never happened, it's diverted. So through the program, it may say pending if someone looks at it, but once they graduate the program successfully, that charge is no longer existent in their file. So we are a multidisciplinary team approach, and like I said, with all the agencies that I mentioned earlier that sit on the drug court team in McCracken County, we meet every Tuesday morning at 7:30. There's between 10 and 15 of us from every agency I discussed. We talk in depth about each one of these clients, what they've accomplished, what they haven't accomplished, what their needs are, what barriers they're having, what they need that's not being met, what services they need more of. And then we go into court with these clients at 8:30, and the judge talks to each one of them one-on-one. They're called up in front of the judge. He lets them know what they've done good at that week, and he gives them accolades and attaboys and applause. And if they've done something wrong that week, we take care of that as well. Everyone says, so do they go to jail? No, they don't go to jail. We have several different, they can go to jail, but we have several different sanctions that we try to utilize and use before we use incarceration. And that could be a written assignment, that could be a verbal from the judge, it could be community service, early curfew, ankle monitoring. We try to use any and utilize every option that we can before we have to incarcerate. And then when we do incarcerate, we try to do a flash incarceration, which is generally 2 to 3 days incarceration. Incentives, we want to encourage the good, just like we want to sanction the bad. We need to encourage the good, and we need to be more encouraging of the good behavior, because we're changing behavior here. And incentives can range from everything, like I said, from attaboys to applause to handshakes and fist bumps with the judge to incentive cards or mugs or travel passes, later curfew. There's a whole rash of things, and we're always constantly trying to think outside the box to come up with something new. So not only are we treating substance use disorder in our program, we want to treat the whole person. So what I mean by the whole person is 90% of our people have also co-occurring disorder, mental health disorders, and trauma. So we have to treat all of those. If you're going to be successful at treating the addiction, you have to treat all those underlying co-occurring disorders as well. And that's where we rely on our community partners. McCracken County is blessed to have the community partners that we have and the resources that we have in this county. We utilize Four Rivers Behavioral Health, Emerald Health, StepWorks, Fuller Center in Graves County. We utilize Merriman House for domestic violence, Lotus for sexual assault and sexual violence. But then we have to look at those basic needs. When someone first comes into us from jail, a lot of times they have no family support, they have no housing, they don't have food, they don't have the fundamentals that we all have daily. And if I don't have a place to lay my head tonight and I don't have food, I'm not going to care if I get high or not. So those are the first things that we have to immediately, in the first phase of meeting that individual, we have to connect them with those resources in the community. So we rely a lot on our sober living homes in McCracken County, Oxford House and Hope for the Broken. Back 5 years ago, 5 or 6 years ago, we had none. Today, I think there's about 11 or 12 sober living homes in McCracken County, and we need more. But we want to, today statewide, we're changing our approach and the way that we look at things, our language, because like someone said earlier, language does matter when you're talking to these individuals. We also want to build on that recovery capital. So recovery capital, the more recovery capital somebody has in their bed, the more successful they're going to be in their recovery long term. And those recovery capitals are not just treatment, family, social supports, medical, employment, their basic needs, their housing, transportation, all of that, faith or social-based services, supports. And then that leads into the next thing is, for years we've all been taught that AA and NA is your pathway to recovery. And I think we're all learning more and more that there's several different ways to path to recovery, and it's not a cookie cutter program. It's not everybody, it's not a one size fits all. What works for you may not work for this person. And we want to push that because we want people to find their purpose and their connection in their community and what works for them. Because once they find that purpose and their connection in their community, again, they're going to be more successful in their recovery long term. So, is there any questions?
We'll hold some questions until the end, but one of the other things is drug court has graduations that you can attend to show support for the people that are completing the program.
Yes, we do, and I tell people if you really want to see what drug court is and what it's about, graduation is the best opportunity because they get up there, they like to tell their testimonies and their stories, and they tell you where they were when they first came in, and to hear what they've accomplished and what they've done and where they're at on graduation day, that gives you a pretty good view of what they have done in drug court and what our purpose is and what we're trying to help them do. And we are having a graduation this Thursday at 3 o'clock, second floor of the McCracken County Courthouse. It is open to the public if anybody would like to attend. And then Saturday at 10 o'clock at Stuart Nelson Park, we are having McCracken County Drug Court softball tournament, and it's also open to the community. We'll be playing other drug courts in our region, and we'll be playing Turning Point Recovery Center. Brandon Fitch was here earlier. They've really been talking some smack. And Center Point, but that's also, we encourage, community support, these people, seeing people showing up for these activities, supporting them, that feeds them, and they thrive on that.
Thank you. Blake?
So I'm Officer Blake Quinn of the Paducah Police Department. My fancy title is the Community Engagement Officer, and I do exactly what it says. So that covers anything from reaching out to the community through social media, or being a member of the Opioid Task Force, which so far my job has been pretty rewarding because I've just learned so much about this community. Some of the things that we do at the police department, unfortunately, the previous services were always kind of on the back end of where we show up.
And some of you, if you listen to Pandora Radio, might have heard Blake talk about the Good Samaritan law on the PSA. But Blake, if you want to go ahead and clarify what that means here.
All right. So the Good Samaritan law started back in 2015, and what it says is that in good faith, if medical assistance from drug overdose is sought, more or less from what they call a public safety answering point. So that's going to be our 911 dispatchers. That's going to be an officer that drives up on something, or if someone notifies emergency medical services. What that means is that if they're requesting the emergency assistance for themselves or another due to a criminal offense of like a controlled substance, then what's going to happen is we're not going to charge them for that, because we see that the need for them to get the treatment and get help outweighs the criminal offense for it. And ultimately, too, the evidence for the charge of the prosecution, if it's based on that call for service, we're not going to prosecute it. We're going to make sure that they get the help that they need.
Perfect. Thank you. Ryan?
Hi, my name is Ryan Wilcutt. I'm the Chief Deputy at the McCracken County Sheriff's Office. I think we're doing a lot of great things over at the Sheriff's Office when it comes to this subject matter. All of our deputies are trained and carry Narcan in their vehicles and are trained on it. I think this past year in 2022, we recognized everybody who had a Narcan save, and we probably had close to 20. After an incident like that where we respond and that is administered, all of our deputies have a card where they scan a QR code, and that goes directly to Brandon over there at Turning Point. From there, we communicate with Turning Point, and we do a follow-up appointment after that overdose. One of our deputies goes out there with him, and they try to make contact with the subject, talk to them, offer resources. A lot of times we try to send the deputy that was there the day prior, a couple days prior, just to put that face to the meeting and the individual. We also partner with the Papillon Center here in town, do a lot of work with them, and all of our deputies have been to initial training with them that they've put on to us, just to kind of give our deputies some insight into trauma and some of the things they're dealing with. A lot of times in the past, law enforcement is seen as, they're going to respond and they're just going to take somebody to jail. There's a lot better ways to address these problems that we see in the world and on the streets rather than just incarceration. So we're just trying to put that out to our deputies just so they're aware of it and cognizant of it, and maybe see things on a call that maybe isn't, something that taking somebody to jail is going to fix. Maybe there's some resources they can provide or anything like that to better help address the problem. I would say the biggest thing we do at the Sheriff's Office is the Badges of Hope program. Many of you probably heard about that. We've partnered with the health department through some grants. We've done commercials for it. Billboards, a lot of other things out in the community, advertise it on our website and a lot of social media output with it. But the Badges of Hope program is the Sheriff's Department acting as a middleman to getting people to treatment. We probably have 3 to 5 calls a week for it. A lot of people will just call and ask for information about it. Others actually go through and want the assistance, but anywhere in McCracken County, we will come pick somebody up and take them to a treatment facility. We partner with Turning Point, we partner with the West Kentucky Addiction Center, and we will provide them transportation to the facility if they're wanting help. People who are reaching out are a lot of times don't have the means for transportation. They ask about insurance coverage. Obviously, that's not something as far as insurance we deal with, but we can at least proctor getting them to the center and getting them in the door and talking to somebody. That is incumbent upon us. They do not have an arrest warrant. If they do have an arrest warrant, that will be dealt with first, but certainly after they have seen the judge or are bonded out, then we will take them, continue on that process with them. I've done it a couple times personally. I've had people surrender narcotics to me. They're kind of at their breaking point. You know, I hear I have drugs. I would like to give this up and I want to go get help. And we will do that for them through Badges of Hope. So I would say that is the biggest thing we are doing here in the community. It's been going on for a couple years now, and it's going pretty strong. We're proud of it.
And everyone has a pamphlet in your folder in there, and in that pamphlet is on the front is a picture of Ryan being compassionate in a photo shoot. So we're very happy to have all of these organizations here today to kind of show and highlight how the court system and law enforcement has evolved and adapted to meet the needs of our community, and that a lot of times it gets lost that law enforcement and the court system, they're people too, they're affected by this too, and they do want to help in the means that is available to them. So are there any questions about any of the programs, anything for them in particular about anything? Yes.
So what's expected for the Sizzle Bank rollout in this?
Well, what we're looking at is, like I said, on May 24th, we are looking at having actually to vote on when it is. So we're hopeful that we can start July 1st, or probably after the holidays, so July 10th, and then make it August 1st, September 1st, October 1st, and get all 11 pilot counties by the end of the year, up and at least started going on. Since it hasn't been voted on, I'm not going to say, but we have a variety and everything. And I will say our pilot counties, everyone's very interested to get started, specifically because of that funding piece and so on and so forth. And if you don't mind, I did want to say something that's a little bit different from Senate Bill 90, or Behavioral Health Conditional Dismissal Program. That's different from drug court. I don't know if you all caught what Crystal said versus what I had said about SB 90 is looking at low-level, low-risk defendants, whereas drug court is looking at high needs, high-risk defendants. And that is and how SB 90 is really trying to divert folks from the court system completely, because research shows the more that someone is involved within the court system, at least on the low end, the more likely they are to become involved again. So we want to keep them where the whole goal and why it's so treatment oriented is to keep them away from the courts. And even, and I wish that I had mentioned, with this program, there are no sanctions. So if you are, if someone is non-compliant, we will have a designated person called a case navigator who will try to get the participant back in compliance, do whatever it takes to do that. And, and then even then, worst case scenario, get it back on the docket, for a prosecutor to look at. And then if the prosecutor says, okay, we're done, we've given them a bunch of chances, all that happens is their case continues. They do not go back into custody automatically, anything like that. So once they enter into SB 90 or into the program, it tolls all proceedings. So their case is just kind of in limbo until the end.
I have so many questions.
Okay, go ahead.
But first,
Yes.
so after completing the program, the charge disappears.
Mm-hmm.
Does the arrest disappear?
I do want it's expunged.
Because in North Carolina, we usually have to pay to make arrests disappear.
if things are expunged, it should take care of all of it. It is, so it is gone. So, and it's, like I said, at no cost, because usually there is a fee you have to pay, and so that's not part of it anymore. Yeah.
And Crystal, two things. I'm delighted that you're embracing multiple pathways of mutual support. Do you require folks to attend mutual support meetings like AANA or alternatives? And if you do you accept their attending digital files?
Yes, so we do require, we call them recovery support meetings now, because your recovery support meeting might be at your church, it may be at the YMCA. And through COVID's taught us that there's a lot more alternatives with the virtual world. So if someone does not find one that they can utilize or they don't feel connected to here in our community, they can access those virtually.
That's brilliant.
So.
And there's data supporting the
There
effectiveness
is.
of digital recovery
Yes.
support meetings
Yes.
having the same outcomes.
Yes.
Just not the same smells.
Yeah, and I think,
And you meet people's basic needs initially in the program through partnerships.
that's
What
correct.
are your biggest gaps there? Because there's complex needs.
Transportation and housing,
Transportation and housing.
yes,
And in recovery supported housing, which you do have some access to.
right.
What are some of the barriers there? Are sometimes your people being turned away? What are those-
So there are certain organizations that run a democratic organization, and the other peers in the House have to interview and vote on you. And so if they don't accept you, you don't get in, and this is kind of my take on it. I don't always agree with that, because if I have learned that our people have issues with each other on the street while they're in their addiction, or they have issues with each other in jail. So if you get 2 or 3 in that house already, and then you're trying to interview to get in, if they don't like you, then you're not gonna get into that house, so that's kind of a, that could be a barrier at times. But we do have some that are very open, and I call them, say, hey, we have an individual here who needs recovery housing. If they have an opening, they'll say, send them over.
So the democratically accepted, that's part of the Oxford House model. You also have the Kentucky Recovery Housing Network. Is folks within that network, do they sometimes also have that democratically accepted, or is that not part of
I'm not
that?
as familiar with that network right now. That's kind of newer in our area, so I'm not as familiar with that network or how that's going to work at this time.
Thank you.
Caitlin, I would also like to go back, and we were talking about harm reduction, and I stepped completely over that earlier. So also in our program, we do educational groups weekly with community agencies and partners. They come in weekly and do classes for those in the early phases of the program, phase 1 and phase 2. And that is where we also do Narcan training with our participants quarterly, and it's available if they wish to take it. That's also where we do on-site. We have agencies come in and do on-site HIV and hepatitis testing, and they can get those referrals then if they need them. So that's a piece that I should have mentioned that I didn't.
Your treatment course come a long way since I interned there many years ago.
And that's the new language too. We're trying to get away from drug courts, and we are becoming treatment courts, because we do have not just drug court, but we have veterans treatment court and mental health courts under that same umbrella.
Is there any other questions? Go ahead.
Solicitor Officer Wilcutt, how many people per week, referrals per week, are you getting for the Baptist Vote?
I'm sorry, say that again?
For the Baptist Vote, how many people are referring to treatment each week?
We have a reporting portal that we use it for everything, our scheduling and everything, but we have a thing built into it called Badges of Hope, like contact. So either a deputy out on the street or someone in the office can fill it out. And it's just, we keep documentation of, and some people just call and want information, say thank you and hang up. And some people say, well, can I get a ride here? So we'll help that out. I would say I see probably maybe 3 to 5 come through about a week. You know, 1 week it might be 5 people that go to treatment, and 1 week it may be just 1 and 4 people call asking for information. So it's kind of hit and miss, but I would say it's something that has been ramping up since we've started it over the past couple of years. So it's definitely in full force at this point.
Is this something you share with other counties or would you be willing to?
Yeah, absolutely. So when someone calls for a ride, it's not just secluded to McCracken County. All the purchase area sheriffs have an agreement with each other. We've taken people from Paducah that need to go to Fulton. So we have worked with the Graves County Sheriff's Office and the state police, and we've gotten them down to where they needed to go to have a bed. Same thing if someone's in Callaway County and they need to get up to Paducah somewhere, we'll work it out between the sheriff's offices. Between all the sheriffs have an agreement, so they can drop Marshall. Someone can take them to Benton. Marshall County can pick them up and bring them to exit 16. We'll pick them up and bring them downtown. So yes, I mean, it's a collaborative effort and there's agreement between all the purchase area sheriffs.
And one of the great things about the Badges of Hope program is that it fills a gap. The Angel Initiative is a fantastic initiative by the state police, but it requires someone to come to the post, which, as you know, our location is kind of geographically large, and so if transportation is a barrier, sometimes people will have a hard time getting to the post to access the Angel Initiative. And so the McCracken County Sheriff's Office, through the Badges of Hope program, have filled this gap by providing the transportation to someone when they call, picking them up. In some cases, through the grant that we have currently, we'll pay for a cab if the person doesn't want, a law enforcement officer at their house. That we can do something with a cab, but it has to be originated by the McCracken County Sheriff's Office. It can't be originated by anyone else in the community. Are there any other questions? Yeah.
Well, this morning Donnie told us not to quote law enforcement officers unless we ask permission. Officer Quinn, you said our first priority is to save a life.
That's correct.
Is that quotable?
Yeah, that's quotable, absolutely.
Yeah. So, and to piggyback off what Ryan has said, all our officers are trained in the use of Narcan, and not only is that a vital tool, but that reporting process is just as vital, because while we may be able to bring them back in that moment, we really need to do our part with our community partners and make sure that we're doing what we can so we don't have to do that again. You know, because every person that we go out and we have to apply Narcan to, you know, that's someone's mother, that's someone's brother, you know, and so we want to make sure that the families and that particular person has a chance to have a successful recovery.
And Chief Deputy Wilcutt, you said you've had about 20 reversals?
I would say in 2022 we did, yes.
2022, that's awesome. We have a grantee in West Virginia that has created a pin. It's nice, looks good on the uniform, says I save lives for deputies and officers who had reversals.
Sure.
Yeah.
Yeah, that's cool.
Do you have
We don't have anything in place, no. At our yearly award ceremony, we have a certificate. It's an naloxone life-saving award that we give out to everybody who has saved that year.
That's brilliant. That's better than a Boy Scout badge.
Oh, well, I was going to say, do you want pins? Like, you know, we
Yes,
can
we do.
You do?
Yes.
Yeah, we can provide pins. Yeah, that's fine. Are there any other questions?
It says on here that they would integral part in the MAT program. Now, is that, y'all, what do you mean exactly by that?
So those who are screened and are opioid dependent, up to their medical provider to make that decision whether they need Suboxone, Vivitrol, or Methadone. But yes, I have 6 participants currently in my program utilizing MAT.
Okay, that's wonderful.
Yes, go ahead.
When you say that they see a provider, is that a physician or?
Medical provider, doctor, physician.
So how many does the McCracken have in the psychiatric realm? Is that what they see?
They can choose their medical provider for MAT. Are you talking about MAT or their?
I was getting confused
We have one general psychiatrist at Four Rivers, but there are some other agencies in the community that are getting psychiatrists in. So if that person chooses that and their insurance will pay for it, we would allow them to go to that for that service.
You do not have to be a psychiatrist to prescribe medication-assisted treatment. So many of your primary care, your nurse practitioners, they can. There is something called the data waiver, and there's actually some legislation that's going on around that, and we're waiting to see how it kind of applies in Kentucky, but that's a certification to prescribe buprenorphine. And so there's a bunch of different providers that can do medication-assisted treatment. And as many of you know, we are a health provider shortage area, even with the hospitals, and we serve the whole region. Like Paducah pretty much serves the whole region when it comes to medical and, you know, recovery, treatment. Like this is the epicenter. And so we are a health provider shortage area, so there is a lot of different people that come in as providers. You know, you have your licensed clinical social workers, you have different people that are, you know, creating this bubble around someone. So I'm not sure if that helps answer some of that question, but there are different providers in the community that are able to prescribe different things.
Yes, I think I misunderstood, but yes, currently I can think of 6 providers in our community that do at their agencies or their offices prescribe MAT.
But if you know psychiatrists that would like to come to our area, we could use them. Like,
So are you saying that we do not have enough psychiatrists in our community?
100%. Like,
How many psychiatrists could be utilized if they were in our community? And I'm asking that because Leanne and I work on our community health needs assessment for our hospitals, and it would be good to put a number to say we do not have based on the need.
So I guess really to come up with a number that would do that, you would need some sort of screening tool to be able to then put how many people have been screened in or possibly, you know, have a mental health or a substance use disorder that would require care from a psychiatrist, and then apply that to the population, and then determine what a psychiatrist's caseload could be, and then figure it out from that point how many psychiatrists there would have to be. I know that there's a need for adolescent and child psychiatrists, like that's a huge need right now as well. But without, and this is the thing too, is without good screening metrics, without good data sharing, diagnosis data, without that, there's not a lot we can do to bring in some of the things that we need, because if we don't know what the needs are, we can't try to find a solution for that need. We can't write grants for that need. We can't adjust, like, you know, each one of our organizations could adjust staffing if we knew the need was there. But if we don't share data with each other, and we don't, you know, do our community health needs and, you know, do ESPER and do different assessments and screen and share aggregate numbers, there's nothing that we can do to solve these problems. We need to come at it as a community with a data-based approach. Does that help? Does that answer your question?
I was in contact with an individual that we're looking at a possible $2 million grant to have a clinical rotation in the last 2 years of medical school for that psychiatric component. You know, medical students have 2 years of didactic education plus 2 years of clinical. One component of the clinical rotation is psychiatric, and they wanted to bring them into the purchase, and they wanted to know if we could utilize telehealth along with their experience here. So I said, you know, absolutely, I think that would be a great idea, but it's also a recruitment tool. When you have a student in there, especially looking for your medical students, they get more comfortable with the region, and it allows us to recruit them back once they finish the residency program. I remember it's like just a psychiatric residency program is 4 years, and child and adolescent fellowship is 2 years after that.
Wow, I did not realize it was this long. But that's amazing. That's, if you need anything from me, let me know.
We could pull from here. It seems like, I'm not saying we have enough, we just have lots of good non-physician providers in our region, but I think oftentimes we're handicapped because we don't have a psychiatrist that's a physician or a
agree, especially when you see a lot of dual diagnosis and the severity. You know, everyone has different skill sets and different abilities, and yeah, we need more psychiatrists for, especially for the dual diagnosis population. Yes.
As a provider, you have to have a special DEA license in order to be able to prescribe. So it's not everyone can just
Yes.
prescribe.
Yeah. Yeah. Sorry, I didn't clarify that. Yes. Yeah. Is there anybody else that has any questions? Go ahead.
How is the best way for us to approach when we have a warrant for one of our patients? How, in order to protect the other patient's family, as forthcoming and helpful as we can be?
So, like from a facility standpoint? Yes. Okay, so on a facility standpoint, you can always call our non-emergency number. The dispatchers we have, the telecommunicators, actually cover the whole county, so they'll respond. You know, so if it's in the city, we'll respond. If it's in the county, the sheriff's department will respond. If you're aware of the warrant, just call the non-emergency line, and then from that point. If the resident or the patient is aware, obviously you can move them to an area away from everyone else. Other than that,
We're not usually aware of the warrant until
okay,
we get there.
I understand. So if
We want to build the bond as much as we can.
yeah, and I think what that ends up doing is, especially from a medical standpoint, is there may be. So everybody leans real hard on HIPAA. There's some law enforcement exemptions inside of HIPAA that allow for things like that as far as the disclosure of information. So with that being the case, obviously we want to work on you guys to make it as easy and an easy transition as possible. So if there's a particular way that works best for your facility, obviously just reach out to us and say, hey, this is who we are, this is where we are. In the event of this, contact this person. And we'll work through it together.
Thank you.
No problem.
Are there any other questions? Alrighty. Well, I want to say thank you so much for everyone here coming and sitting on the panel. We really appreciate them coming and talking about their different programs and everything. And all of our speakers, want to say thank you for them coming and speaking today, and our sponsors and our vendors and our subcommittee and all of you for attending and trying to make a difference in this realm. So with that, we are adjourned. You will receive an email if you registered for the evaluation. You should get that tomorrow so that you can complete that and get your CEs. Thank you.